We have breaking news on the health of Pope Francis, with the Vatican reporting that the 88-year-old pontiff suffered new breathing issues that required doctors to take action and provide mechanical ventilation. NBC's Claudio Lavagna is live at the Vatican. Also with us, MSNBC medical contributor Dr. Vin Gupta. So, Claudio, what more is the Vatican saying about the Pope's condition?
Hey, Chris. Well, in the last hour, the Vatican said that throughout the afternoon today, the Pope suffered from 2 acute respiratory crises caused by what they say was a significant accumulation of mucus in his airways, a consequence of that bilateral pneumonia he's been suffering from for more than 2 weeks now. As a consequence, the doctors had to perform 2 bronchoscopies. The doctor will correct me if I'm wrong. It's a thin tube they insert into his airways to look at the lungs, and also then they had to remove the excess mucus. Then he was put back on that non-invasive mechanical ventilation system that is a mask that covers his mouth and nose to help him, that pumps oxygen to help him breathe. Now, the Vatican said that later in the day the crisis was over. The Pope is alert, was alert at all times. He was cooperating at all times, but at the same time, of course, the doctors say that especially after this latest crisis, the prognosis remains guarded. It means that the Pope is not yet out of danger, Chris.
So, Dr. Gupta, the Vatican's update, as we just heard from Claudio, includes terms like acute respiratory insufficiency, aspiration of abundant secretions. Put that into layman's terms and the level of concern it would mean for any patient at 88 years old.
Chris, this is concerning. So acute respiratory insufficiency, essentially for the lay public, that means that he's having trouble breathing and it's happening quickly. And for many people, that would mean we would have to put somebody on a ventilator. In his case, we're managing it non-invasively. What does that mean? For those that might be familiar with the CPAP mask at home for sleep apnea, it's similar, slightly different, but it's what we do in the ICU to prevent, as an intermediate step, to prevent having to go all the way to a ventilator. Pope's very, very fragile right now. We've been watching this for about a little over a week. He has underlying lung disease. He's had part of his lung removed, Chris. He has underlying asthma. So what does that mean? That means when you add pneumonia on top, he's battling a severe infection, and he doesn't, like many of us, have the ability to just cough that out over time. So secretions are pooling in his lungs, and it's resulting in probably his inability, like today, to actually clear them. And he's having to have his doctors assist in clearance of those secretions through the insertion of a camera into his lungs, bronchoscopies, which, I as a pulmonologist do all the time. But that's not a good sign that he needs that. And I do worry he might need more support in the form of a ventilator if this continues.
So, look, what we've seen over the course of his hospitalization, Vin, is that he's had setbacks and then improvements and then setbacks and then improvements and now a setback again. For someone with his medical history, as you said, he had part of a lung removed when he was a young man. He has had respiratory problems in the past. What does this mean? Is it to be, I don't know if you would say, is it to be expected, or does it make it all the more worrisome?
This is to be expected in the case of somebody with his medical risk at his age battling a severe pneumonia. This is very common for that specific type of patient. For those of your viewers who've been down this road with a family member or a loved one, or if they themselves have been down this road, you know that there's good days and there's bad days. However, this is trending. The fact that we haven't had a series of good days together is not a good optimistic sign. So I am worried, given today's events, multiple bronchoscopies to clear secretions, that we're not headed towards a place of removing support, that it seems like he needs more support. And what does that mean? That means that the next level here is a ventilator potentially. And so the signs here, the trajectory in the last 24 hours is not positive.
Claudio Lavagna and Dr. Vin Gupta, thank you. And still ahead, the discontent over Trump's cuts and how Democrats can use it to their advantage with the president's joint address to Congress tomorrow. Stay close. More Chris Jansing reports after this.